Hey guys, it's Dr. Bree, the physical therapist.
And Lynn.
We are your favorite senior care specialists. So Lynn brought to my attention a very interesting post on one of the groups that you follow on Facebook. And actually it's something that sadly we are seeing more and more, and why I believe more people are actually looking for our services too.
Absolutely.
Yeah. So Lynn, do you want to talk about it? I can talk about it.
Sure. So it's just a Facebook group I belong to, but it's about therapists. They all just kind of collaborate together and maybe discuss difficult cases or complain about what's going on in our
therapy world.
But the most recent one that really caught my eye was this one where it's actually a physical therapy assistant who put the post out there. This therapist was questioning how many visits in a skilled nursing center their family member was going to get based off of their diagnosis. And what I don't think a lot of people realize is when you go to the hospital and because you get sick and they say you need to go to a skilled nursing center, and the skilled nursing center, they have the choice to admit you or not. Like, they can choose you as a patient or not, first of all. So you don't automatically get in. But on top of that, when you're accepted as a patient, they pull your diagnoses from the hospital. They get all the paperwork, blah, blah, blah. They know what's going on with you. The reimbursement that the facility gets is directly correlated to your diagnosis.
The admitting diagnosis.
Not
all of your diagnoses, but
right.
The reason you went to the hospital and the reason you've had the decline.
Right. So that reimbursement that they get from insurance companies directly correlates to how much therapy you will get.
It's a dollar amount based off the diagnosis.
Right. So it's not unlimited. You're not going to get hours of therapy a day. Sometimes you might get an hour a day, and that has to be split up between 2 or 3 disciplines. And you might only get 5 visits. So that's 5 hours of therapy split up over 5 days. And between PT and OT, that's a half-hour a day for 5 days. Sometimes you get therapy on the weekend and sometimes you don't. So sometimes you're just kind of hanging out there. I think the whole premise behind all of this is that depends on what your ailments are, can depend on how much the facility is getting reimbursed or how much they're going to get for providing your care. And that directly correlates into how much therapy you're going to get. And I think behind this whole thing is people think that they're going there to get better and to get the rehab that they need, when in fact they're usually somewhat disappointed because you don't get out of bed, typically, unless the therapists get you out of bed. Oftentimes the staff there does not get you up on the weekends and the evenings. They will serve you breakfast, lunch, and dinner in bed versus getting you up to a chair and having you sit up, or going out to a dining room, or all these things. The kind of care that we expect versus the kind of care that we get, it's a whole lot different.
Yeah, it's definitely changing. So it's, and this is the thing too, like what she's talking about. So it's your admitting diagnosis. So like, let's actually say you are somebody who has congestive heart failure, diabetes, you also have Parkinson's, but then you get a urinary tract infection, and the urinary tract infection causes you to fall, and that's what actually admits you. But then because of the UTI, because of the dehydration and all these other things, you've had a major decline in your functionality. Your Parkinson's is really bad. Your breathing is bad, all of these things. But that doesn't matter because it's based off of the UTI diagnosis.
Yeah.
And that's going to be the dollar amount paying for your services.
Right. And it also tells them, like, your ability to do things. You know, they request, you know, information from the therapist. They submit this stuff to the insurance companies. The insurance companies basically say, well, we've given you all we can give you. Or they're looking at the reimbursement amount and they say,
We can't even do anything for you.
Right. So it's time to go home. Then they get sent home. They're not at their prior level of function. They maybe don't have great family support, but that's not anyone else. That's not anyone's problem. Like the insurance company doesn't have like the feeling that they need to keep you in a skilled nursing center, right? So having family support and other things in place, home health helps, but they're only in your house. Same thing happens with home health. Your admitting diagnosis, your insurance oftentimes dictates how many visits you get, how many times a week, and from which disciplines. It's getting skinnier and skinnier and skinnier how much care people actually get in the home. So depending on your family, your friends, your support, folks around you, hired help, private duty services, more and more and more people are paying out of pocket and depending on these other resources because they can't do it.
Yeah. And the other thing too is like actually getting someone out for home health. Right. So like if it's not an orthopedic case and it's a like let's say it's a UTI with a weakness that comes home from the hospital, I've heard people not getting services for 2 weeks.
Yeah.
2.5 weeks, 3 weeks.
Recently my dad was on skilled care and he got a nurse out within 24 hours of being home, but it still took 7 full days for a physical therapist to come out and evaluate him. 7 full days of being home after brain surgery before a PT came out and evaluated him.
Thankfully, we know a thing or two.
Yeah, I mean, he was obviously getting good care from everyone in our support group, but if he didn't have that support group,
he wouldn't have had that.
He wouldn't have had that.
Yeah. And so like we're talking about this because we are just seeing more and more how little insurance is covering. So that includes like how long you're going to actually be in the hospital for a procedure or if you're ill. And then how long you be in a skilled facility, if at all you go to the skilled facility. And then how much home care you're going to get. Again, really, if any, like we're seeing people only getting like 6 to 8 visits
max,
and you're sometimes splitting that between 2 disciplines.
Right.
Home care, and that's it. And then you're expected to go to outpatient, and this is a lot of situations where people may not even have the means to get to outpatient.
Right.
And we just talked about it too, like what happens if you can't drive? Like Uber, if you're rural, Uber doesn't come and get you and won't take you. Taxis are not super reliable. Yeah, so this is exactly why, like, what we're doing, the wellness stuff, where we come in and we work on these functional things and see people at home, why we're seeing so much more of a demand and a need for it.
Right.
And the other sad thing, too, that I'm seeing a lot is just the quality of care that is even being provided when people go out. Because, I don't know, I shouldn't make assumptions. I'm not doing it anymore. But I think, too, you only have a very short period of time to deliver care. I think there's such high expectations for you to work on so many things that then it's almost like the important stuff doesn't get addressed.
Right. And I think when it comes down to it, getting someone set up on like a good exercise program so that they can carry things over on their own is super important. So it's always like, number one, let's get you some good exercises in place. Let's get you understanding them. And then we can work on other things, but sometimes we don't get to work on other things because we can't master the exercises. Maybe getting up and down is very difficult. Or maybe we just are looking at the things that are super important, like you can't get up and down the steps to get to your bathroom. So we need to really work on how are we going to get you up and down the steps. Yeah. We're problem solving 1 or 2 things instead of looking at you as a big picture because our hands are tied and our time is limited in home care. I mean, I still do a little bit of traditional home care, and it's really difficult sometimes to touch on everything that needs to be touched on. I like to ask people what is the most important thing that they need to accomplish right now. Sometimes it's like, I need my exercises. Other times it's like, I need to be able to get in and out of the house. Show me how to get in and out of the car. I don't even know how to do that. I need to be able to get upstairs so I can take a shower. Okay, all of those things, we can work on all those things right away, no problem.
So just, that's some food for thought, guys. I think you're going to be seeing more and more of this happening where it's going to be less and less time. So try and start getting prepared for these things. So what can you be doing to help reduce your risk of a hospitalization, help reduce your risk of a fall, maintain your mobility? Really try to start being proactive and be like your own advocate in a lot of these scenarios.
Right.
So
no one's going to advocate for you.
No. So really start thinking about those things and getting some things in place. And as always, if we can help you with some in-person or virtual services, you know, send me a text, shoot me a message, and I do a free 20-minute phone consultation, and we'll see what we can do to help you out and get you going. So we'll chat with you guys again soon. Thanks.
See ya.